who has been campaigning and calling for the hospital to be rebuilt ever since he was elected. James, good morning. Thanks for joining us again.
Good morning, Chris.
We've talked about this before, and it's felt before as if a decision is coming. It's perhaps imminent, but it still hasn't been made. No announcement. How frustrated are you that the wait goes on?
Well, I'm incredibly frustrated. I know how important this is to everyone in northwest Norfolk and indeed across the county and more broadly who are served by the hospital, and the patients and staff are desperate for a decision, as am I. So I keep pressing. I was hopeful we were going to get an announcement out before the local elections, and then there are restrictions on announcements. So since then, I've been making the case to ministers to get an announcement out as soon as possible, and I'm optimistic that's going to happen.
You have said that before, though, and I wonder whether you're closer to this process. You speak to the people making the decisions, whereas our listeners and we don't. Have they given you any reasons for the continuation of the delay and the frustrating wait having to go on?
Well, Steve Barclay has said publicly that fixing the RAC hospitals is his priority. The minister who's in charge of the new hospitals programme said we need to get QEH and the other RACs into the programme, and the Chancellor said that the funding has been agreed and there's going to be an announcement soon. So that's why I'm confident. Of course, I'm talking to them directly, talking to the Prime Minister about this. Everyone knows the issues with QEH. But as Steve Barclay said when he came in, he's developing a new approach to building hospitals. He wants them to be done more quickly. He wants them to be done cheaper by standardising design around things like the size of wards and rooms. So that's what he's working at. And then I think that we're going to get an announcement soon on that new national approach, which will set out how that's going to work, and that QEH will be part of that programme.
Until the money is there, until this announcement is made, there will always be some concern and even some scepticism in Kingsley and West Norfolk, because we've waited so long for this. Can you tell us with any certainty that this is when the announcement comes rather than if it comes?
Well, I'm confident as I can be that we've won the argument that RAC hospitals, QEH, and there's 4 others that need to go into the new hospitals programme because they have an end of life of 2030. The building can't continue beyond then. And there's a public risk to safety here that needs to be addressed. So based on all the conversations I've had in public and privately, I'm confident we've won that argument and it's going to be part of the programme. Obviously, it hasn't been formally announced yet, and that's what's the deep frustration. But this is a major programme. This is billions of pounds that are involved here. It's the biggest hospital programme that's ever been. So obviously, the Health Secretary wants to make sure everything is lined up and all the details are there, because we don't want to make pledges for hospitals that can't then be delivered. But I'm confident that work has been completed and that we can now get an announcement out as soon as possible, because people want the certainty of knowing that new buildings are going to come. Obviously, there's then going to be planning and development to get it, but we need to know in principle that we're part of the programme and that we're going to have a new hospital in West Norfolk.
How big an issue has the cost of this entire project become? Because we've been talking to you about this for the last year, 18 months, and in that time we all know what's happened to the cost of living, what's happened to building materials. So what you might have got for £3.7 billion 18 months ago, you wouldn't get now, would you? Is that part of the problem here?
Well, clearly, inflation and construction costs have gone up. That 3.7 billion is sort of the initial budget. There will be additional funding because these hospitals are being built by 2030, so that spending doesn't cover that whole period. So there'll be additional funding, but that's part of the reason why Steve Barclay, the Health Secretary, is so keen to look at an approach that means we can do this more efficiently and also more rapidly to get the hospitals that people want, but having more standardisation, more consistent design, rather than having 40 hospitals designing everything for themselves. You can have a lot of commonality in the design of the buildings and the layout, so that brings down the cost because you're producing things at scale. So that's part of the discussions that have been going on to make sure that we can do that and do that in a credible way. But as I say, I look to what's been said publicly by the Health Secretary and other ministers about recognising the importance of dealing with the RAC issues. And I'm continuing to campaign to get the announcement that my constituents want and that the staff and patients deserve.
What form is that campaigning take? What are you doing?
Well, I spoke to the minister in charge of the new hospitals programme yesterday. I spoke to one of his other ministers earlier in the week. I've spoken to the Prime Minister's team on an ongoing basis since the elections to say that how important it is to get the announcement out as soon as possible to give people that certainty. I keep raising this in the House of Commons. So in public and in private, I'm on this. This has been my top priority. I campaigned for this in the general election, and I have done ever since. So it's been over 3.5 years of campaigning on this. So I'm very frustrated we haven't got it over the line, but we've gone from not being part of the programme to where I think we are now, on the cusp of an announcement that QEH will be part of the new hospital programme.
Looking at it, the hospital will not be able to be used at all beyond 2030. It's already got 4,300 props in place. I appreciate what you're saying about trying to formalise everything and make sure that this can be done in the most cost-effective way. But 2030 is not actually that far away when you think in terms of building or rebuilding a hospital. Have you got the time to wait for this work to be done by the Health Secretary? Don't we need work to start and decisions to be made before that can be done?
Well, I'm working very closely with the chairman of the trust and the senior team there, and their plans are well developed. They've got the planning permission for the car park, which is a key enabling project to allow the hospital to go forward. So they are ready to go, and we need the confirmation to proceed. I think there's still time there's a number of years to get the hospital built and ready to open. The hospital trust are confident that they can do that, and they've been talking very closely with the regional NHS about that as well, to make sure that there's going to be a plan and that we can crack on with it. So I think there's time enough. As I say, I want the announcement to come out as soon as possible so that we can move forward, as do people in other areas who also need new hospitals.
And just to finish with, we know that the Conservatives lost overall control of Kingston and West Norfolk Borough Council in the local elections. Have you been feeding back to party headquarters that perhaps the lack of action on the hospital was one of the reasons for that?
Well, I'm very disappointed that we've lost control of the council, and good councillors lost their seats. And of course, decisions and issues around the hospital were a factor. I was out knocking on doors and campaigning with candidates across West Norfolk, and people were obviously very frustrated we haven't had the decision. I've explained what I've explained, that hopefully it's coming soon, but I appreciate that wasn't enough for some people. So of course that played a factor, as did the challenging economic situation and the high inflation that we're facing at the moment. So they're all factors. We need to get this decision. It's about the interests of the staff and patients of West Norfolk, and that's why it's so vital we have confirmation soon.
When you say soon, I'm going to push you on it. What's your gut? Days, weeks, months? How long do you think those that work at the hospital and are working in these conditions might have to wait before they know what's going to happen?
Well, I'm reluctant to do that because I've done it previously and then it's not happened. So I don't want to give people a false deadline. All I can say is that I'm asking for ministers to get the decisions out as rapidly as possible in good time, because this is a pressing issue where certainty is needed for people here and for people across the country. The government confirmed yesterday that they're committed to the 40 new hospitals, so they now need to set out clearly the plans for delivering those. So I would expect the Prime Minister's getting on with delivery across the piece, and this is obviously a big programme that we need certainty on.
We will keep watching this space. Thank you very much for giving us the latest on that and for joining us this morning.